Your annual physical may be giving you a false sense of security. For starters, it's yearly, which is once a year. So your blood pressure is checked and they listen to your heart and your lungs. They may check your reflexes, order some labs. Then days or a week or so later, you receive a message saying everything looks normal. Therefore, you walk away believing that you have received a complete evaluation of your health. However, an annual physical is not a guarantee that every developing health problem has been found. A normal blood test does not mean that every part of your body has been evaluated, and a 15/20 minute appointment does not automatically answer every question about your health. And a lot of you expect one appointment to accomplish far more than one appointment was designed to accomplish. So let's talk about the upside of annual checkups. All right. So physicals or annual checkups is this type of preventative care or preventive, whichever you prefer. They're interchangeable. And it can include screenings, vaccinations, counseling, and other services selected according to your age, your history, and your risk factors. It's not a collection of tests that work identically for every patient, right? Because we're all unique beings. And so the visit becomes ineffective when you treat it like it's an inspection that you pass or fail. Like you're in and you're out, and then, hey, see you next year. And listen, that's not enough. So today, let's talk about why your annual physical may not be giving you the clarity that you expected and what you can do differently before, during, and after your next appointment. All right, so the first thing we're going to talk about those expectations. So you go to your physical, and usually when you think of an annual physical, you expect this comprehensive and this complete review of everything happening inside of your body. Okay. And usually you think your doctor's going to order these labs that will test for every disease, and uh, the doctor will be able to identify every developing condition. And if that physician does not mention it, then there must not be anything to discuss, right? All right, so after your exam, after your labs are drawn, you get the results. Okay, and most of your results may fall within the reference range. Okay, and then if you have a portal, or you may receive a letter, and it may say something along the lines of no significant abnormalities. And so you think, all right, good, I got a clean bill of health, nothing is wrong. And you really don't think about it until the next year when it's time to schedule your next appointment. But I want to give you something to think about, because that conclusion, it actually may be larger than the information supports, because these routine labs that your doctor orders for you, it only measures what was ordered, right? So, for example, if you get a complete blood count or CBC, it's not going to evaluate every organ, right? And if you get the metabolic panel, a metabolic panel does not screen for cancer, okay? And just a reminder that your physical is only a snapshot. It's only a moment in time, and it's not a crystal ball. And so it doesn't automatically predict every condition that may develop 6 months later. And it may not reveal symptoms that, of course, you may not have mentioned. And, it may not evaluate family history that was never discussed. Okay. So keep in mind that expectations may have an effect on the outcome of our physicals. Okay. So now let's talk about my experience. And, I get, and I completely understand why those expectations may be present when you get a physical. Um, it, in a sense, kind of provides a level of reassurance. And I understand that because throughout my healthcare journey, that lab work, it carried an enormous amount of emotional weight. And, you're talking to someone who's had a kidney transplant. I was diagnosed with lupus nephritis, and I went through the stages of chronic kidney disease. I've got a history of rejection. And listen, I have spent years watching numbers. All right. So for me, lab work was never routine. A change in one number resulted in more questions and repeat testing, medication adjustments, or even additional monitoring, right? And I've learned that even extensive lab tests does not tell the complete story by itself. And so there have been moments when a number was flagged and the situation was not as catastrophic as I feared. But there have also been moments where the numbers require more explanation than my portal or my letter provided. And that experience, just with labs in and of itself, it taught me to not treat lab reports like a final verdict, right? Labs only provide information. It's just a small piece of the larger picture. All right. And the same also applies for an annual physical. Yes, it can be valuable and identify risks and create an opportunity for screening and prevention, but you still have to participate in it. Okay. Um, Next thing I want to point out is a physical is not the same as every possible screening. Okay. It's just an annual physical, does not include every screening that you may need, period. It's a routine service. Okay. And these services are appropriate depending on, several factors such as your age, your family history, your medication, your medical history, tobacco, alcohol use, your sexual history, your occupation, previous results, your risk factors, and these recommendations can change as your life and medical history change. Okay. And I just want to remind you that evidence based preventive care focuses on specific services that have demonstrated benefit rather than automatically performing every available test on every person. Okay. And what does that mean? That may mean your friend or even a relative may receive a screening that you don't receive. Okay. And, I think that preventive healthcare should be personalized, right? Because once again, we're different. And the goal is to identify the appropriate screenings and the conversations and the follow up for you. Okay. And I just want to talk about Medicare for a little bit because with Medicare, this causes confusion. And for those who receive a Medicare annual wellness visit, it's a little different than a traditional routine physical examination. I've had a Medicare wellness visit, and I had it in conjunction with my annual physical. And with the Medicare annual wellness visit, it describes the annual wellness visit as an appointment focused on developing or updating a personalized prevention plan. So, um, you may arrive expecting this head to toe physical and a detailed evaluation of several symptoms, right? But, with the Medicare, it's more so wellness. And so in a preventive physical, which is your annual physical, it's very important to ask if a wellness visit or a visit to address a medical concern will be the focus of the visit, because that one question can prevent a great deal of confusion. Okay. And so now let's just jump into why normal can be misleading. Normal can feel like one of the most comforting words in healthcare, right? Because when you think of normal, it's just like, okay, that means nothing concerning was found. And that reassurance, sure, it can be appropriate. But remember, normal does not always mean that every possible health problem has been ruled out. Because when it comes to these lab tests, labs are usually provided in a reference range. And this reference range is a comparison tool. And it's not a personalized declaration that every system in your body is functioning perfectly. Okay. Because you can have symptoms while common lab results remain within range. And you may also have a developing condition that requires a different test. And in these cases, you may need imaging or a specialist or even just a comparison of results over time. Okay, so the appropriate response is not to distrust every normal result, it's just to understand what's tested and what was not tested, and whether the results explain what you are experiencing. So instead of asking, are my labs normal? Ask, do these results explain the symptoms that I told you about? That's a completely different question. And now I want to discuss why one snapshot isn't the full story. Um, Healthcare is often about trends. One blood pressure reading from one appointment is important. But repeated blood pressure readings may reveal more. Okay. So it's patterns. And, your history and your pattern may provide more context. Okay. One weight measurement, that's important. But an unexplained change over several months may deserve a different conversation. And when it comes to these annual physicals, it's just one snapshot. Your health is a moving picture, right? Because, every day things change. You may be feeling great one day, terrible the next day, high pulse one day, low pulse the next day. And so things to consider are if your energies change, your energy levels, what about your sleep? Are you experiencing new pain? What about your appetite? How's that going? What about your weight? Any weight fluctuations? Are you having any difficulties completing any activities? Uh, what about those activities? Do they now feel less manageable? Or are they more manageable? Or how's your mental health? And have you started any new supplements? All of these details don't appear in your chart, but you have to bring them into the conversation. Okay. And another thing, and I'm really guilty of this. I call this a data dump. Um, when you go to this annual physical, you just dump everything onto your physician, right? Now remember, there are time constraints, and so when you're getting ready to wrap up your appointment, you tell your physician, oh yeah, by the way, I've been having some chest pains, and oh yeah, my headaches are becoming more frequent. Or I've been exhausted for these past 6 months. Usually those type of things do require more time than remains in the visit, and you know the doctor's wrapping up, and you may feel dismissed if you just start to do this dump near the end of your appointment. And what happens, you're revealing all these things, and then your physician's like, oh, we need to schedule another appointment then. Right. And so when you hear that, you're just like, oh man, I just revealed all this information to my doctor, and, this physician doesn't even care about me. But, I don't want you to consider this as dismissal. Um, And sometimes it is responsible, that way of doing it. It is responsible to give new symptoms at the time, and just, give it the evaluation it deserves, because, your annual physical may not be the right setting to fully evaluate these complex or urgent concerns. Now, I'm not saying be quiet, of course, mention them, but keep in mind that it may not necessarily be a good idea to wait an entire year to report these concerning changes. Um, sure, preventive care is important, but symptoms that were previously mentioned, these chest pains and the dizziness and so forth, these symptoms may require a separate diagnostic conversation. So, as they come up, bring this to your doctor. Don't wait, okay? Because you could be prolonging something that may need urgent attention, okay? So, what do you do before your appointment, okay? Because your annual physical begins before you enter the examination room, okay? So, I want you to prepare. And I want you to start with, we'll keep it small, three highest priority concerns. I wouldn't bring like 12 or 15 concerns, keep it small because of the time. If there are other matters, that's when subsequent appointments should be scheduled or so forth. But for this annual physical, I want you to write down when these three priority concerns begin, when each one began, and describe how often it happens and explain what makes it better or worse, and include any symptoms, and mention whether it interfered with sleep or your appetite, work, exercise, or any of your normal activities. Okay. Update your medical list, not your medical list, but your medication list. I want you to include all the prescriptions and over the counter medications, your vitamins, herbal products. Yes, some doctors may give you the side eye, but look, we want to be transparent here. Any injections, any creams, any medications prescribed by a specialist. If you can, include the dose and how often you take these medications. Um, and listen, there really is no benefit in pretending that you take a medication perfectly when you don't. Okay. Um, your provider needs accurate information, not a perfect patient performance. Okay. We are human. We may skip a dose here or there. Ooh, life happens. Okay. The second thing, your family history. I want you to review your family history. Um, because your family history changes, right? A parent may receive a new diagnosis, a sibling may develop cancer, a relative may experience a heart attack or even a stroke, or there may be a new diagnosis with diabetes, genetic condition, or kidney disease, and all this information could affect the questions that your provider asks or the preventative services considered for you. Note that I'm switching between preventive and preventative because they are interchangeable. And so before your scheduled appointment with your physical, sit down and ask yourself, has anyone in my immediate family received a new diagnosis since my last visit? You may want to call and be like, hey, how's your health? Do you have any new diagnosis? What's going on? You taking any new medication? What is it for? Find out how old they were when they were diagnosed. Find out if there's a trend in your family. Do multiple relatives have the same condition? Or find out if anyone developed a serious condition at an unusually young age. um, don't assume that the information has reached your medical record through another family member. Bring it yourself. All right. Yes, it's work, but this all helps paint a clearer picture for your health. Okay. So let's now discuss. I want you to know what preventive care you may be due for. Okay, so let's talk about what preventive care you may be due for. Okay, and in this case, I do not want you to rely completely on your memory or whatever was in your portal. I want you to sit down, review any screenings. If you get vaccinations, review these vaccinations that may be due before your appointment. And I want you to ask your provider, based on my age and my history and risk factors, which preventive services am I due for? Could be a mammogram, could be a prostate exam, colon cancer screening, eye exam, gynecological exam. Um, and, based on that, I want you to follow up with, is there anything I am not due for yet, but should plan for in the next few years? And, in this right here, it just helps you to really get into that preventive plan for yourself and, being more proactive about your care. Okay. Um, and another thing you could do when you're at your physical is just straight up ask, hey, what is not included in today's visit? Your doctor may be like, wait, what? It may throw that provider off, but it establishes expectations. It may minimize some anxiety for you. And it may also help you realize or learn that a specific concern may require another appointment. Or you may even learn that a test that you expected is not routinely recommended for you. And so it just helps you to be more proactive and learn how to plan ahead. And then if you have insurance, it may help you learn that insurance coverage distinguishes between preventive care and evaluation of a new problem. And with insurance nowadays, I think it's vital to know that difference, because, yeah, nowadays insurance will only cover certain exams, certain wellness checks versus other types of services. So I think it's just good to really go in knowing what exactly to expect. Okay. Um, at these annual visits, I think that it may be natural to think, hey, I want you to test me for everything. But remember, there is no single test for everything. Okay. Um, and so what I want you to do is just, focus on whatever the purpose of the physical is for. Okay. I know. That's just how it is. And, I want you to instead just ask, instead of saying, test me for everything, ask, hey, what are we looking for? And if you get your lab order, point something out and be like, hey, what would this result tell us? And, what will we do differently if this result were abnormal, right? Or what symptoms or risk factors make this test appropriate for me? I think that those type of questions create clarity. All right. So, I love posing questions. So now let's jump into 5 questions to ask during your physical. And the first question is, what has changed since my last visit? All right. Now, this is for those who have had repeat physicals with the physician or this physician who has access to your prior medical records and so forth. Ask your physician to compare your current information with your previous information. Ask what's changing. And then question 2, ask, what are my biggest health risks right now? All right. And I think that this question makes the conversation more personal, because you don't need a list of every disease that exists. You just need to understand the issues that deserve your attention. Okay. And, if your family does have a history of certain conditions, ask, hey, based on my history, my family history, and my current results, what should I be most focused on? Question 3, which screenings or vaccinations, if you get vaccinations, am I due for? So don't assume that everything is automatic. Ask directly, and then ask when each service should occur. This will help you paint a picture on how you want to move forward. It will determine, if you want to get a vaccine or not. This is all great for planning. Question number 4, do my results explain the symptoms that I reported? Now, this question, it separates reassurance from resolution. While your results may be reassuring, your symptoms may still require further evaluation. So definitely ask that question. And then the last question, because it says the physical, what is the plan after today? Ask like, listen, do I need a follow up? Do I need a referral? Lifestyle changes, a screening appointment, do I need to repeat labs? And then after that, ask who is responsible for each next step and when it should happen, right? Boom. Those are the 5 questions. I don't want you to leave your physical with vague advice. All right. Sometimes your doctor or your provider or whomever gives you instructions like eat better, lose weight, reduce stress, get more sleep. Sure, they're reasonable recommendations, right? But they're still vague. So I want you to ask for specificity. Okay. I want you to get them to be like really super specific and just be like, listen, you want me to eat better, be more nutritious, right? Eat nutritious foods. So you know what? Push back. Say, hey, ask, what is one realistic nutrition change you recommend I begin with? Or if they say, you know what, move more. Well, what type of exercise is safe for me? Okay. How many days a week should I aim for? Could any of my health conditions or medication affect that recommendation? Push back and, be very specific. Request, require, demand the specifics. Okay. Because a general recommendation becomes useful when it turns into a plan. Okay. So, yeah, when it even comes to food, just be like, all right, you want me to eat better? Is there a dietitian or a physical therapist or, another professional who could help me? Because listen, it's hard out here trying to do all this stuff on your own. Ask for help. Okay. Next, I want you to ask for your numbers and their meaning. So when you get this lab result, ask what the important numbers mean for you. Which results are most relevant to your health. Okay. Ask which results have changed, which ones require monitoring. You want context here because Your portal or a letter or what have you just gives you access to the numbers. It's not interpretation. And you know what? You deserve context. So I want you to ask for the numbers and their meaning. And then this next topic that I want to discuss often gets overlooked, but you know what? I want you to ask about it. I want you to discuss mental health, because mental health should not be treated like a separate universe from physical health. Anxiety, stress, depression, grief, trauma, sleep difficulties, they all affect how you function and how you manage your care. And they affect your medication adherence, right? Your concentration, your relationships, your energy, your appetite, your work, your ability to navigate a complicated healthcare system. And so don't wait until you're in a crisis to discuss your mental health. Say, my mood has changed. I've not been sleeping. I feel anxious most days. I don't feel like myself. I'm struggling. Bring that into the conversation because it is important. Okay. And yeah, dude, I want you to do that. And I also want you to talk about what you are actually able to do. Okay. And what I mean by that, I want you to talk about whether you can climb stairs, carry groceries, can you cook, can you concentrate, are you sleeping through the night? I want you to, all these things, as far as your functionings, are there any changes in your function? Because these changes offer important context. So I don't want you to only just report pain levels or lab results. I want you to discuss what's changed in your life because of how you feel, and be specific. Say something like, 6 months ago, I could walk 30 minutes. Now I need to stop after 10. And this is all useful information. Next, I want you to create a follow up system because a physical is not complete just because, you're done, you've left the building. Um, I want you to, this is all about being proactive. And, before that appointment ends, I want you to ask, how will I receive my results? When should I expect them? Who should I contact if I don't hear anything? What should I schedule before I leave? I don't want you to just rely on memory, right? Because, healthcare systems are busy and messages get delayed. Referrals do, in some cases, require authorization, and these appointments fill up. And, I don't want you to think that following up is being difficult. You're closing the loop to your care. Okay. Now, when should you not wait for a physical? And I don't want you to wait for your physical to discuss a new or a worsening concern. And some of these that I've mentioned before, chest pain, difficulty breathing, confusion, uncontrolled bleeding. I want you to seek urgent care or emergency care when it's appropriate. And remember that annual physical is just preventive. It's not an emergency plan. Okay. And I want you to contact your healthcare team sooner when these symptoms are persistent or they're worsening or affecting your normal function or concerning you. Okay. It's scary, yes, but I don't want this delay to potentially cause even worse issues. Okay. All right. Now, one of the reasons that I built my app, Alvora.health, is that a lot of patients are often handed a great deal of information in one short appointment. All right, you get these lab results, medication changes, visit summaries, follow-up instructions, and all of this. And Alvora.health is designed to be a healthcare clarity companion. It's not a replacement for your physician. It doesn't diagnose you. It doesn't decide which treatments you receive. It just helps you better understand and manage the health information you already have. And you can use it to make sense of lab results in a more simple and understanding language. And it can also help you organize questions before an appointment, and it'll help you review information afterward and prepare for a more productive conversation with your healthcare team, because your annual physical should not be something that happens to you. It should be a conversation that you actively participate in. And your annual physical is not failing because preventive care doesn't matter. Preventive care is important. Okay, it matters enormously. Some screenings can identify conditions earlier. Vaccinations, if that's your vibe, it can prevent illness, and counseling can reduce risks. But, just one annual appointment, it cannot carry the entire weight of your health. Okay. It can't personalize generic advice unless you explain what is realistic for your life. All right. But the better approach is not to abandon the annual physical. I just want you to use it differently. And I want you to prepare before you arrive. I want you to bring your priorities. I want you to discuss changes, ask what you're due for. I want you to understand your results. And I want you to create a follow up plan and say something when it doesn't make sense. Because the goal of this appointment is for you to leave there knowing what was reviewed, what the results mean, what still needs attention, and what happens next. So before your next physical, I want you to do one thing. Write down your 3 most important health concerns, and then write down 5 questions beneath them. What has changed since my last visit? What is my biggest health risk right now? Which screenings or vaccinations am I due for? Do my results explain the symptoms I reported? And what's the plan after today? And I want you to take those questions into your appointment. All right. Because, don't depend on memory when you go to this appointment. And so when your lab results arrive, I want you to download my free Clear Lab guide using the link in the description. And inside, you will learn about the 12 most common lab tests. You'll learn what they measure, why providers order them, and which questions you can ask about your results. Because better conversations begin with better understanding. And stay tuned, because what I'm going to talk about next is what hospitals will never tell you about how long they have you for.